Thank you to Jenny. Thank you to Megan for your keynote. Thank you, Cynthia, for your words. We will now transition into the Healthy Chicago Equity Zones panel. But before we do that, I have two quick good news. One, the food is here, so can we get a clap for that? I know we got a lot of questions regarding food, so we got it. And second, the AC was turned on. So just for those who are sweating like me, no, the AC has just been turned on, and that is working now. So now we will invite those involved in the HCEZ panel. And while they are coming up to the stage, we will also be showing a video. So please give your attention to the screen. And
deploys hyper-local strategies to the Healthy Chicago Equity Zones initiative deploys hyper-local strategies to confront the social and environmental factors that contribute to health and
Excuse me, while we transition, we're going to work on that video right now, but if those on the panel can still come to the stage, we're going to work on that now as we speak. Thank you.
racial inequity with the ultimate goal of closing Chicago's life expectancy gap. It has been over 2 years since the launch of the equity zones, and since then, the
So here on stage, I apologize about the video. We'll work on that, but we'd like to show you that, so we will work on that later. But on the stage, we have the HCEZ partners on stage, and also we will have the Northwest Center Executive Director, James Rudick, as our facilitator. So James.
Thank you. Good morning. How's everyone doing? Okay, good. It's good to see so many people here gathered together to celebrate public health in Chicago. As you heard from Megan and Ginny, so much work has gone into the health equity zones, and I'm really excited that we have 6 individuals who are on the ground leading that work that are going to share with you all their stories, their successes, and what this work means to them. As you heard from Ginny, what's really unique about the work that we do is that it's community-led, community-driven, and it's rooted at making sure that the South and West Side, as well as Chicago, is 6 regions, 1 Chicago. And so that's become our motto. So we're really excited to share the successes with you of our work, our lessons learned, and what the work means for us. I'm going to ask everyone to first introduce themselves, your name, the organization that you work for, your pronouns, and then I'm going to throw one question in here that's off script for all y'all, so on the fly. What's your favorite thing about Chicago, our one shy that we love? So as you introduce yourself, if you could let everyone know one thing you love about Chicago, and I would love if Dr. Peppers could start, and then we'll just go down the line.
Hello, everyone. I'm Dr. Yolanda Peppers. I am a community lead for Sinai Community Institute. And the one thing, just one thing?
One thing, your top thing that you love about Chicago.
The one thing that I absolutely adore about Chicago, and it just came into existence for me, is Mahogany Tours. It is a new historian, a group of young black men that have put it together, and that's my favorite for today.
Thank you. Jessica?
Good morning. My name is Jessica Biggs. I work with the Southwest Organizing Project, and I'm the director of Healthy Southwest and also our Southwest System of Care there. I use she, her pronouns, excuse me. And a favorite thing about Chicago, just one. I mean, frankly, the summertime and all of the free outdoor events that are opportunities for community to come together and to relate to one another. So, thanks for having me.
Dahlia?
Good morning, everyone. Dahlia Aragon. I am she, her pronouns. I am the community lead for Albany Park North Park. located on the northwest side, work for North River Commission. I'm gonna assume a lot of you agree with me on this one. The diverse food. I love the different amount of like dishes that you can get no matter where you go in Chicago. So, thank you.
Thanks.
It's almost, it's only 11 o'clock. Good morning, everyone.
Good morning.
Yes, we're coming in like it's hot. So we're gonna say, let's go. My name is Dr. Joyce Chapman. I am the Far South Region Coordinator, and I am a she/her. And one thing I love about Chicago is the people.
It's always hard going behind Joyce Chapman, but it's always a pleasure because she sets the tone. Good morning, everybody.
Good morning.
Thank you for that. My name is Allison Scrutchins. I have the pleasure of being here on behalf of the Greater Auburn Gresham Development Corporation. Woo. Hey, Near South in the house, representing the Near South region. And so I don't know because I'm a foodie and she stole my answer. My favorite thing about Chicago is the food. Like whenever I travel and go somewhere else, I'm always ready to come home and eat. But I would also say my favorite thing about Chicago is our communities and what we represent. There's no other place in the world that has the 77 communities like we do and how we come together and how we empower one another. And thank you guys for having me.
Thank you.
Good morning. My name is Nadia Jimenez. I'm the Director of Community Health and the Regional Director for the North Central region from Swedish Hospital. It's really hard being the end of this line because I would want to say all the above because they all took it as it came down. And of course you took the most important one. I would say one of the best things I love about the city of Chicago is the uniqueness of every community, that we really, every single place, especially I would say in the North Central, I call it my little United Nations. Every neighborhood, every block is a different community, and it's really fun to just walk the neighborhoods, go to the parks, go to every different event, and really be able to embrace the diversity of the city.
Thank you. Thanks, everyone. And thanks for going with that question on the fly. I thought of it this morning as a really great way to get to know you all outside of the work that you do. And so we have 6 prepared questions that our panelists are going to answer, and then we'll have time for all of you to ask them some questions about their work. So different individuals will answer different questions depending on the question I'll ask you, and I'm also going to help keep time. We have about 40 or so minutes for the panel, so I'll help keep us on track if we are going a little long. The first question is really a framing question and a background question about the Healthy Chicago Equity Zones. And the question is, what makes the Healthy Chicago Equity Zones unique? And I'm going to ask Dr. Joyce, Nadia, and Dahlia to answer this question. So whoever wants to start.
You said my name?
I did say your name, Dr. Joyce.
Okay, it's me. One thing is unique about HCEZ and the fundamental purpose that CDPH, in my lens, for the Far South Side, they got it right, engaging community. Because the playbook has been developed by the community leads and entrusted all the information that was in there because it was with the community. And that is so important. CDPH could have came out and did a thing of its own, but they didn't. They relied upon us. We are the trusted messengers in our communities. And that's one thing I applaud CDPH doing for us under HCEZ. Thank you.
Thank you, Dr. Joyce. Nadia?
I think I'll just add on that and say the uniqueness is the ability to also find community partners that, just like I was saying before, the diversity of the city, finding those partners that connect directly to those communities. We use the Health Atlas to find the partners that really speak to the needs that were in those areas. So the ability to control and find kind of the uniqueness of each neighborhood and the uniqueness of those partners also, and celebrating those neighborhoods and be able to work together.
Thank you.
And to piggyback off of all of that, I too think that what is really unique about this is that it is community-led. we have been entrusted to go to the community, talk to community members, and ask and hear from them what is impacting them in their community. So I think this whole process really opened a space to one solution does not fit all. There are 77 different communities. We're all very unique and diverse. So being able to do the work, boots on the ground, and having CDPH come with us along for that, I think is what makes this process and the work of the Healthy Chicago Equity Zones really unique.
Thank you. To all my government folks in the room, we're seeing a theme here, right? About what it means to be community-led, community-created, co-created, and letting the community lead, right? So I think that's something that's so unique about the health equity zones that I want to uplift again. As we think about how to do this in your work, right? Especially for those that work for the city or other government, this is an example of it right here, right? Of how you let community lead in the work. So I appreciate those answers. The next question is going to switch gears and talk a little bit about data. So how are health equity zones using data to identify and address health disparities in your specific region or community? And I'm going to ask Jessica if you want to start, and then I'll go to Dahlia and to Nadia.
Yes, I'd love to talk about data. So I want to take 2 steps back and really talk about what set the context for this work. And that was our COVID response, right? And the Racial Equity Rapid Response Team. And I think one of the things that was unique and so important about that partnership was that it absolutely was community-led. We were at a moment in our city's history where city government recognized that they needed community voice to figure out how to appropriately respond. And one of the key pieces of that whole recipe was that we had immediate access to as granular data as we wanted by census tract to take a look at where we were seeing cases, where we were seeing hospitalizations in our community. And we were convening once per week with community voice to say, here's what I know is happening there. We had epidemiologists and folks from CDPH saying, this is what we think might be happening, and together devising strategy and response that really, I think, it saved many, many lives throughout the city. But I think that foundation as a way of sharing data as a common language and then adding our stories on top of it to determine a response has been really critical to the whole of this work.
Yeah, definitely +1. Dahlia?
Yeah, so very similar to what Jessica just said. I think what we saw through the process, having not been part of the COVID response, but coming into it after, was that we had access to the data through the Health Atlas and other outlets, but through the engagement that we did, all of the focus groups and surveying and just conversations, it also allowed us to collect a good amount of qualitative data, and we were able to gain knowledge on what gaps in the data that we do have access to were being identified by the people in the community. So a big example for us was in housing and public safety. So with housing, what we really learned during the outreach with the community was that the data did not reflect all the stories that we were hearing from community members. The amount of unhoused individuals that we were having conversations with was double what is in the data. Families that were like, well, I'm living with, my aunt, I'm living with my parents. Like technically, by definition, they were unhoused. So we had several unhoused families that were really struggling to get back on their feet. And then I think for us in our community, that was what was skyrocketing the amount of COVID cases that we were seeing. So I think with this work, we really were able to identify some gaps, but then really hear what stories were behind them. And I think it's allowing us to move forward and address the fact that, we do need housing for all. We do need public safety strategies and solutions for all, but they will be different amongst all the different communities.
Yeah, so well said, Dahlia. Thank you. And I mixed up my panelists. I'm going to go to Allison, not Nadia. Sorry, I was reading the wrong question. So Allison, last perspective on this. How are you using data?
So You know, I think piggyback is going to be our theme today because this is the work we do. But it was the data that was led was from the community, right? So we met them where they were. We had surveys, we had focus groups, we had meetings, we had Bright Stars, shout out to them. They started a men's focus group that's still going. You know, these are the things that were implemented, and we noticed that our community needed it. So I think the biggest thing is that typically when funding comes, you know, the directions come from the top down. But not only was this community led, but we had the opportunity to actually talk to the community and then implement the things that the community asked for. So where can we meet you? What are your needs? You know, what we talked about in the Near South region was we actually learned that the community thinks that violence is a public health concern just like we do. We thought that they may be so used to it and think that this is the norm, but no, they don't like it either. They want it to change. Not only do they think that violence is a public health concern, but they think it's related to mental illness. So we heard from the community that one, you think we have a mental health problem as well. Two, you think that we have a violence prevention problem as well. And three, you're tired of it just like we are. So what can we do to make sure that we're working together, we're meeting the community where they are, not just having events, because we had a lot, but also being able to suffice the need that they are voicing to us. Not only listening to them and saying, okay, we'll take your concerns back, but actually coming back with a program, an initiative, an event that's based around that. We had a mental health event when people were sitting on the ground, making flowers, beating on drums and talking about their feelings. They had never done that before. We had so many people express to us that they are looking for the solutions that we are trying to implement. So what I will say is that the data allowed us to reconnect to the community. So not only have we created these things based on what they wanted, we're now working with them in tandem, creating new programs with them, coming in, having other organizations, not just us as the lead organizations, but empowering our local organizations to also do the work. So I think that the data allowed us to reconnect to the community, and not only are we addressing the health disparities, but we're learning specifically from them what they think the health disparities are. And that's what I think was most important with this.
Thank you, Allison.
Just
really
to
well
add
said.
to that, you made a really good point. I think this work has allowed us to collect data from people that are not always at the table and not always giving us, like, not always ask, like, what's wrong or what's impacting your life. And I think, like you said, we were going to different people's, like, intentionally. We were going to schools, we were meeting with the youth council where they wanted to meet, we were meeting service providers, you know, during their lunch, just to hear them vent to us, like, this is what I'm facing every single day. So I think it's also important to note that we were able to collect data many times from people that sometimes could fly under the radar, like even if you're doing the census, it also depends who is filling out the census.
Thanks, Talia. For those that may not be as familiar with the Healthy Chicago Equity Zone model, there's 6 regional leads, and then each regional lead works with local community groups. So some of the stories you heard from Allison were that model, right? So though there's a funded organization, that organization passes through resources to organizations by community within each of the regions, which supports that hyper-local approach that we talked about. So I think the success of the hyper-local approach is it's not 6 organizations doing the work, it's 44 community leads plus 6 organizations, so it's 50 organizations that are doing the work on the ground in community, and each organization is doing it differently. So our next question is actually going to ask for you all to share some success stories about the work that you're doing and what successes have you seen in your community. And so I'm going to ask Jessica, I'm going to ask, let me make sure I get the right list here, Jessica and Allison to kick us off here with some success stories from your regions.
Sure, I'd be happy to. Just have to throw out a COVID plug. We changed the color of the map, right? Yes. It looks differently because of this work. So that's one success I want to name right off the bat. We are a more deeply connected Southwest side than I think we've been because of the HCEZ model that has provided funding in order for the sole reason of building relationships between institutions We are in deeper relationship with one another. We're better able to pivot and respond. We learned how critical that was during COVID. I think all of us know in any work that we do, right, the more that we are on the same page and working in the same direction, the more effective that we are. Most recently, we've had a really strong example of that, thinking through the response to new arrivals on the Southwest side and immediately being able to convene partners on the Southwest side that are in relationship with one another, have a shared interest, and are able to think coherently about how we need to be working together to respond and not to duplicate efforts. So those relationships that have been established and the ways of working that those relationships enable, I think are a huge success of this project.
Thanks.
I don't know where to begin. We have so many success stories, right? I want to first, sorry, James, shout out to the other regions that I see in the crowd that are always on our weekly calls. Shout out to Patrick in the back. Shout out to Ladarius. Any other HCEZ 6th region people, can you raise your hand? Can we give them a round of applause? Woo! Because this is the team. We are on a weekly call every 3:05, Jessica will tell you. And we talk about everything about what are our success stories, what can we do better. And I think the biggest thing is to mention, James, thank you for pointing out, it's literally 50 plus organizations that are doing this work. The 6 regions have 7 to 10 community leads under them, and we are so grateful. So our success stories in the Near South region, I just shouted out Bright Star. I have to keep that going. Joni and Bright Star, Pastor Chris Harris. With our health assessment, we had to do surveys, focus groups, and what was started was a men's focus group, and we had black men in a circle talking about their feelings. Where does that happen? Nowhere, right? They felt as though they never had a place to actually come and feel safe to talk about the things that they actually go through. Not only being a black man, raising children, being in a community in the city of Chicago is hard for them. And so that focus group started because of the health assessment, and then they said, why can't we keep it going? So the focus group still happens. The men are still talking, they're still connecting, they're still collaborating. And then the women said, what about us? We need a focus group too. So we're creating safe spaces for our people to be able to actually talk about the things that are affecting them, the health disparities in their households and their communities. We learned that diabetes is an issue just like to them, just like it is to us, and what the statistics that we see online. So the biggest thing I would say, our success stories are rooted in the fact that we were able to actually talk about the health disparities with the community members, build programs that still go to this day. And it's going to continue. These are the foundation of new things that are going to be happening 10 years later. We're going to have some amazing man that says, yeah, I was in that Bright Star focus group, and that's what made me start my mental health organization. These are the seeds that we're planting, right? So our success stories are rooted in so many different organizations and being able to make sure that we're touching the people where they are, but we're also listening to them and supporting them. So I think most importantly, we started things with this grant that are going to happen for decades to come. And I think that that is the biggest success in what we're doing.
Thank you, Allison.
So we talk about successes. Do we look at the kaboom part of it, or we touch a person's life? We made an impact there, a quantitative impact. First of all, I want to say thank you again to CDPH, because we got to come together as regions, and we got to know each other. And that good old 305 call every Tuesday, that is success. To be on screen for an hour, maybe 2 hours, to get information. But here on the far south side of Chicago, far south region, is that we have 13 communities. And within the 13 communities, let me use an I statement. I was dragging my feet to go to Mount Greenwood in Beverly. Let that resonate. And we made some inroads there. One of our staff, one of our co-workers was on the LSC at Chaz School. And respectfully, I was kind of nervous going in. We came in like 5 or 6 deep, and we had food to bear, and we thought that would be our, good gift, but they were very receptive. So it was my attitude, my own barrier, that I did not allow myself and our team to move forward. And when we went into the process of the focus group, it was an easy peasy, yes, and they were ready, and they wanted to expound on what they talk about for about an hour or so, right, Dr. Robeson? And as well as this one lady in the group said, we opened it up, and she said, I'm not a racist. And then she poured down crying. And we had to tell her, this is a safe place for you to engage in conversation. And how do we elevate that and to immerse the conversation so we could be a healthier us? Not you, healthier us. And from that point on, all of a sudden I saw the students from CHAZ, as well as staff and community, come over to Phalanx and get a tour of the STEM lab over there. And we're making great connections. And even with the aldermen, we have great connections there too. So successes, yes, they're small in some areas. And then we could go kaboom, and they are really large. Our community leads, we come together, it's one band, one sound. In Japanese is Itai Doshin. We are many bodies but one mind. So as we continue this work, in all our regions, we're going to be successful because it is community-led. Thank you.
Thank you, Dr. Joyce. It's a really good transition into our next question, and I want to give a shout out to the Office of Equity and Racial Justice, because so much of this work is rooted in racial equity and justice, because that was the foundation of the Healthy Chicago Equity Zone. So our next question is, how can the equity zones be used to promote racial equity and social justice? And I think, Dr. Joyce, you gave us an example, but we're going to hear from some of the other panelists about how this work is racial equity work at its core. And I'm going to ask Dr. Peppers to start us off, and then I'm going to go all the way down to Nadia, and I'll come back to Dahlia.
Okay, good day, everyone. I have my notes, so I'm going to be reading from my notes so that I don't forget anything. So the question is, how can HCEZ be used to promote equity and social justice? When I pondered this question, I was reminded of an acronym for justice that is inclusive of equity. They cannot be separated. I would like for you now to close your eyes. You're in a safe space, and visualize the word justice as I give the acronym. Justice unites souls together immediately concerning equity. Equity, justice is no respecter of persons, of culture, of race, gender, socioeconomic status, or educational heights. Equity, social justice is a right that must be given to all. Our HCEZ data obtained, the on-the-ground dialogue, our direct observations of peril obtained from our constituents must be utilized to promote and disperse equity, justice to all humankind. This, colleagues, is how HCEZ promotes equity and social justice.
Thank you.
Beautifully said, and I don't know how to follow up after that. For the North Central region, I think one of the biggest things that we found is access. And recognizing the misconception of the North Central region, we do have the beautiful lakefront, but there's a lot of data that comes in to really note that we need to improve our health literacy. That the region alone, I can tell you within the city of Chicago, within the region we have over 50 languages, just a couple city blocks around the safety net hospital of Swedish Hospital itself. And really bringing to light and understanding, as we have a high refugee, immigrant, asylee population within our area, understanding the different kinds of access to our hospital, the different kind of access to healthcare information, and making sure that our community partners can be that voice, and for us as well as the community members understanding how to access it, because everyone deserves full access to all the care that we have here in the city.
Thanks, Nadia. Dahlia, you want to round us out?
Yeah, so for the Northwest region, I definitely want to take a pause and mention that we did lose one of our team members, Ruben, to gun violence during the process. Ruben was a huge support. So I think when I'm talking about equity and I'm talking about justice and just how this work has been able to move things forward, I think it's an acknowledgement that it is important to hear directly from the people who are being impacted, to get an understanding of what they know. Because a lot of times when we were having conversations, people know about mental health, people know about gun violence, people know about healthcare. They know about all of these resources, but it is about access. A lot of times what we would hear is, well, you know, I was intimidated to go in because the application was in English and I'm Korean or I speak Spanish or Tagalog. So I think that it's really important to kind of understand that while we are all as a city facing a lot of the same challenges, every different region, like the Northwest side, you know, we're facing some challenges that are a little bit more elevated, mainly because there is a feeling of, well, we don't have access to that, or it's not as bad for us, so we should not ask for that. And I think that that is where we start seeing the inequities, this fear of, well, we don't deserve that, or it's not as bad, so, you know, we shouldn't ask. And the message that we've been delivering is, no, we all deserve to be equitable. We all deserve to have an understanding. We all deserve to have that confidence of saying, no, I need this. This is going to make me better. It's going to make me healthy. It's going to make me more stable. And the hope is that through addressing that and through sharing those messages, we'll be able to continue to promote and fill that gap, the life expectancy. Albany Park, Belmont Cragen, Hermosa, Logan, these are predominantly Latinx communities, but there are so many other ethnicities that are there, and I think it's really, really important that we elevate their needs, elevate the culture. One of the things that we learned through this is culture is really important. What type of food do you have available to you? What type of food people were receiving during the pandemic was a huge concern that they raised. Hey, I don't need canned food. My culture, my diet requires a lot of vegetables, a lot of spices, a lot of different things. So I think it's really important, and it's been something that we've been learning through this work, that being able to be boots on the ground and connecting with people in their communities where they're at does elevate the fact that we can create equity and we can continue to share social justice. And hopefully, like at one point, Chicago will be healthy and we will see a smaller gap in that life expectancy, because we've been hearing from each other, learning from each other, and working together to implement the solutions that the people are telling us will fix and improve their lives.
Thanks, Talia. All right. We have about 10 minutes left and 3 questions, so I'm going to combine the last 2. I'm going to switch it up here a little, but I'm going to first go to our second to last question, and these are all around vision. So we're going to end with our vision of the Health Equity Zone work. And this question is, what would happen? We're going to first start with the negative. What would happen if Equity Zone stopped today? Could you tell us what it would look like if there was no Equity Zone? Then we're going to talk about what your vision is for the future with Equity Zones. But let's first give folks a picture of, if you all weren't here today, what would happen? And I'm going to ask Allison, Dr. Joyce, and Dahlia to all share, and then we'll go into our vision after that.
Okay, so I'm going to answer the second question, because that was our question. It's the same thing. What would happen if HCEZ stopped today? Or could you paint a picture if HCEZ never happened? And the picture I want to paint to you guys is the safe spaces that we created. Imagine if we never had that. If we didn't have HCEZ, we would have never vaccinated 50,000 people. We would have never had survey results from 2,000 people. We would have never had focus groups that actually allow people to communicate the things that they're going through in their communities. So if HCEZ never happened, we would never be elevating our communities forward like we we are. We literally hear from them what they believe the health disparities are, not just what statistics online are telling us. So what I want you guys to think about is the fact that if HCEZ never happened, we would have never been knocking on your doors to get you vaccinated. We would have never been telling you to come out to this mental health event so that we can help the kids understand the importance of mental health, so hopefully they don't pick up a gun. We would have never been able to have these conversations that allow us to create a safe space so that we can create healthy Chicago communities. That's what I want you guys to know. So if the funding stopped today, it really puts a halt in the way that we've been moving our communities forward. And I know that you may not be on that weekly 305 call, so you don't know just how much work goes into it, but I hope that we've painted a picture to you today so that you see the importance of it, because this funding cannot stop. We cannot afford to stop this funding because we have goals to reach and we want to have healthy communities in Chicago. We deserve healthy communities in Chicago.
That's right.
And it's not just about gun violence. It's about access to health care. It's about not having food deserts. It's about quality grocery stores. It's so many levels to health care. So many levels to make sure that people have the same resources on the south side of Chicago that they do on the north side of Chicago. We need to make sure that just like they can walk and feel safe and date on Division, you can walk and feel safe and date on 75th Street. It shouldn't be a difference. So what I want you guys to think about is the fact that we can't afford for this funding to stop because we've come so far.
Yes.
And all of my HCEZ people will tell you, and we're not stopping.
That's right.
We're looking for more grant funding. We need you to tell the city officials to fund this line item. We need this money so that we can keep this great work going. So I hope that I painted a picture for you about what it will look like if it was never to happen. And then I also hope you guys know that we can't afford for it to stop.
That's right. Thank you, Allison. Dahlia, and then we'll go to Dr. Joyce.
Hard act to follow after that. Everything she said, but I would say as well, I mean, the community-led work stops. We lose all that progress that we have made through this work across the city. I think for us, if it stops, we break that trust that we have instilled within our communities, with the different groups of people that we've been talking to, with our youth. We have found success in elevating this work and connecting enough with our youth that they are implementing programming. They have said, well, this affects me in this way. I believe in restorative justice. I think my parents should know about it. I think my school should know about it. We will do it. If you can support, then we will do it, and then we'll teach our peers to do it. And I think if HCEZ stops, that is a lot to lose. Once you get youth invested in being part of the solution and leading the solutions, that is a huge gain. They are the future of this work. So I think for us, we want the city to continue to fund it. We want to continue to work with organizations, but also it does come back to the state as well and the federal government. It is important that everyone is invested in this work because we don't want to let the people down. If this stops, we cannot finish implementing all the different projects and strategies that we've already been discussing for the past several years. And I think it's important to acknowledge that people are invested, not just organizations, not community leads, not the regional leads, but the people in the communities have become invested, and they are worth the investment. They deserve that investment.
Thank you. And last perspective on this question, Dr. Joyce.
So they said everything. They said everything. But ladies and gentlemen, sit in these black chairs. We got to do the work. We got to empower those community leads. I was tasked as a region coordinator for Far South for Phalanx, is to identify the community leads. And we did. I did. And they were so gracious, but we empowered through the process of, under leadership with Dr. Robeson providing workshops. They got a little bit more knowledge. And then even CDPH, Jenny, said, go out and join in with the diabetes. Now we're a diabetes guru. You know, Dr. Robertson and I and Holly, we went through a 6 weeks programming, training, intensified training. Now I'm a diabetes guru. Okay, don't write that down though. I don't know how good I am. And then we got to go and say, connect with Rush Hospital. Then now we got to be a C-SCAN members with Rush Hospital. Thank you, Christy Edwards. And at the end of the day, ladies and gentlemen, like my 2 colleagues said, my people on the streets, it cannot be a pause in this work. It is so important. But if anything I hope you take away from this, it is community-led. Right. It has a very impactful process of community. And although I pose this to Far South region, what if you ain't getting no more money? What will you do? They did this. They stood strong and said, Joyce, we will continue the work. Because at the end of the day, ladies and gentlemen, the community leads, all 13 of them, was empowered through this process for this past year, 3 years, because we all became so qualified doctors and everything like through the process. And again, as always, I'm going to say this at the end. Thank you, CDPH, for allowing us to be in that space and giving us that opportunity, all the regions, not just Far South, because this has to be done together. 6 regions, 1 Chicago. Thank you.
Thanks, Dr. Joyce. Thank you. So we have about 3 minutes left, and then I want to save a couple minutes for questions. So our last question, I'm going to do a 2-part, and I'm going to ask you to answer in a minute or less, which is, what would the equity zones look like if you had the resources, right, your dream, or what is your vision for the future of equity zones look like? So I'm going to combine our last 2 questions and ask you to answer one of those 2, and I'm going to give you a minute, and I'm going to start with Dr. Peppers on the question of what would it look like if you had the resources you needed for the equity zones?
If we had all of the resources that we needed for the equity zone, think about the word all. That's paramount. That means that we're not going to lack nothing, no thing. That means that we would have a peaceful community, a well community, and that every single thing, psychosocial, substance abuse, mental health, physically, nutritionally, everything. Can you imagine living in a community where we have everything? If those needs are met, it will then be correlated with our well-being. If it's correlated with our well-being, then it's correlated with our life expectancy. So if we had all, we'd have it all.
That's right. All is all. Next, I'm going to go to Jessica. Jessica, could you tell us your vision for the future? And then I'm going to pop down to you, Nadia, as well. Vision for the future.
Sure. I'm going to give just a piece of my vision, and that is that this is not just a CDPH initiative. A piece of my vision is that every single city department understands the power that exists within the Healthy Chicago Equity Zones. The way that we have organized our regional collaboratives, our hyperlocal collaboratives, are not only an important vehicle to implement initiatives, but to get community voice and to really develop a thoughtful, reciprocal relationship between community and government. As I think about the plans that have come out of the Office of Equity and Racial Justice, I would really like to see the Healthy Chicago Equity Zones be used in thinking about how to implement those plans. But this is not a health department initiative. This is an initiative that I think is really critical to all of city government. That's right.
And Nadia, we'll end with you before we turn it over for questions. What does your vision for the future look like?
I'll go as fast as possible. I'll have to say that I agree with everyone, obviously, in the panel, but wanting to continue the impact. If, what you asked before, if what happened without HCEZ in the city of Chicago, truthfully, the world is watching. What the impact we have done in the city of Chicago with HCEZ is being looked at not only in the city of Chicago, but the state of Illinois and national funding, which is then going to lead to international. We have the opportunity to continue to be this voice and to show as a big city how we're really treating and serving each community uniquely and what the needs are. So my vision is let's get loud and keep doing the impact and keep really changing the world.
That's right. Awesome. So I think we have time for one, maybe two questions. I saw a hand there, and then we'll see if we have time for one other question here.
Yeah, and I think it is publicly available, right? I'm looking at Megan because I'm trying to name exactly where, but it's on CDPH's website. So all of our community health assessments, including the hyperlocal assessments that were done, all of that data, I believe, is on the CDPH website. But got it. Thanks.
And I know there was also the COVID dashboard was available that had information about COVID. So there's a breakout group this afternoon where the epidemiologists could talk specifically about long COVID. I know that we had case rates, we had positivity rates, we had changes in COVID rate and infection rate, testing rates were all available on the COVID dashboard through the city. And so I'm not sure that long COVID data has been updated, but if you go to the epidemiologist breakout at 1 p.m., they'll be able to answer where some of that data lives around COVID longevity. I think we have 2 more minutes, and we had one question in the back, and then maybe if we have time, I see a person here, and then here, Margarita.
Thank you. Dr. Dorian Miller, University of Chicago, thank you so much for your passion in addressing these issues. We are a city that has world-class universities that focus on research. How can academic health centers and universities within the city of Chicago support the vision of the Healthy Chicago Equity Zones?
Well, my first answer was give us some money. You know, the elephant in the room, we need some money. But I'm proud to say that University of Chicago started off as one of our community leads, and they did not accept funding because they already knew they had enough money being the University of Chicago, so they were still, right? So they were still dedicated to the work that we were doing. And so they are a part of our regional, our community leads. And so I think that that's an idea of mine immediately, that they can get engaged with the regional leads that are doing the work in any way, whether it's funding, resources. I mean, the data that we received from University of Chicago about their focus groups and their surveys was just mind-blowing. I mean, they had quotes from youth and so many different, I mean, it was about 30 pages, you know, so being able to actually share those resources with us about the work that you guys are doing so that we can collaborate on work together. And then, you know, the work that we're doing in the community, if you got a budget line item for it, we can definitely get it done. But I definitely think it's just about collaboration. It's an opportunity for whoever is in that region for you to collaborate. So, of course, University of Chicago, you're us, hey, over in the Near South region. And I would love to talk later. We work with LAIF very closely. And so, yeah, that's a way that you can support.
Well, right now, Far South Region, we do have partnership with IE Rush Hospital, as well as Northwestern University and Loyola. Am I correct, Dr. Robeson? I know. Okay. So far, but as always, for anything to go forward, especially in programming, it takes finances. So I don't want to think that we're a money-grubbing people, but yes, we are. Okay. So help us push our programs, help us push our regions to really be that quantitative resource in the communities continuously.
Okay, so I think that's it for time, but all of us are going to be right there at those tables now. So if folks that we didn't get to, Margarita, I know there was a question there. If y'all are cool, we're going to all be at our tables. I think we want to give folks that need a bathroom break or some time to just stretch. We'll be there to still answer questions before lunch, and I think we have the next 30 or so minutes. John's going to come tell us. So we'll still answer your questions. Sorry we couldn't get to them with everyone, but we want to be respectful of everyone's lunchtime. So John?
Everyone give a round of applause for our HCEZ team. While they are getting off stage, I do just want to remind you of the agenda. We will now be going into a time of networking. Thank you to James for mentioning the, yes, thank you for James. Just as he mentioned, the community leads, the regional leads, their tables will be set up over here. So if you were not able to ask a question but do have further questions for our HCEZ network, know that they will all be right here. We will have networking, partnering time from now until 12, and a reminder that lunch is at noon. I will again announce that. But right now, please stretch, introduce yourself to others, say what's up, see how you're doing, and check out our other partner tables and the entrance room as well. Thank you.